Welcome to the Cardiovascular Pulse, where we dive into medical breakthroughs, leading technology, and healthy lifestyles. Join us as we empower you on your journey to a healthier and stronger you.
Hi listeners, previously we discussed what vein disease is. Today we're taking it a step further and learning how to treat it. Joining me today is Dr. Amit Amin, interventional cardiologist at Cardiovascular Institute of the South in Lafayette and Jennings, Louisiana, to dive into what treatment options we provide here at CIS for vein disease. Thank you for being here with us today, Dr. Amin.
Yeah, thanks for having me. Appreciate it.
First off, before we go into the treatments we offer, how is the diagnosis for vein disease?
There's a multitude of ways to do it. The easiest way and the best way to do it is the examination. Initially, patient comes in, they tell us their history, what symptoms they're having. At that point, we'll kind of fine tune it from there. Examine their legs is one of the key implements that we can use, and figuring out we use a criteria called the SEEP criteria, which we evaluate through a 0 through 6 to tell us exactly the severity of the disease process. And then that way we can, after we do our exams, we'll take pictures, regular pictures to documentation, and then we also have a thermography imaging process where we can see underneath the skin and see if there's any big varicosities kind of heating up the surface of the skin. At that point, we'll go back and then do the ultrasound, which is a non-painless modality. Takes about 30 minutes to 60 minutes, depending on the intensity or how complex it is. And then we come back and then we get the results and we go over that with the patients together. Sometimes we do also, depending on the patient themselves, if they have some asymmetric disease, if one side's bigger than the other, especially the left, we will entertain the idea of doing a CAT scan here in the building also, which also takes about 10-15 minutes to do. It really depends on the SEEP criteria itself. The higher on the SEEP criteria, the more chance they have some central disease also. So we kind of do a comprehensive workup on them between the physical exam, the questioning, the ultrasound, and maybe a CAT scan.
Absolutely, and each of the diagnostics are tailored to each individual patient here. Right. And so whether through pictures, going through risk factors, ultrasounds, everything's pretty simple to diagnose vein disease, you would say.
Yeah, it's very, very simple. The patients find it very comfortable too. They don't feel like they're getting poked and prodded. Yes, but when we do the CT, they have to start on IV, but we have excellent nurses and techs down here that can get that sorted out, so it's not a problem. Otherwise, it's fairly straightforward and very quick.
Absolutely, that's wonderful. And now, after the diagnosis, what vein disease treatments do we offer here at CIS that patients can look into?
Recently, we've been adding quite a bit. The typical ones include central iliac workup using a CAT scan. And then we do the ultrasound we use for other veins from the groin down to the ankle area. And so we include ablations, which it's kind of the mainstay in the beginning part of the algorithm that we use. And then thereafter we offer some cosmetic stuff also, which has been new per my little repertoire that we've been adding. And the cosmetic stuff is more down the line. It's not initially. You have to figure out what's causing it first, because if you start taking care of the cosmetics first, patients don't get a good outcome and they come back with more of the same kind of varicose veins or spider veins or reticular veins. They don't get too happy with that. So You have to figure out what's causing it first. Majority of the time, once you take care of the feeder branch, those reticular veins, the spider veins, and those varicosities kind of shrivel up by themselves.
Right. So exploring what the root of the problem is and then going from there and then going into the cosmetics. So these procedures, are they done here at the clinic?
Correct. Yeah, they're done up on the Lafayette building. Typical procedure, depending on what we do, range from 2 minutes to 10 minutes. Wow. And they're walking the same day. Typically after the procedure, we will wrap them up. They actually go for a walk for about 30 minutes. Sometimes in the summertime here in Louisiana, we try to tell them to go to Costco or somewhere just to get out of the heat.
Right.
But during the other times, we ask them to walk around the building or go home and walk for at least 30 minutes. And then a good exercise program for about 48 hours with the wrap on. So they're walking at least 5 minutes to 10 minutes every hour for the next 48 hours until they come back for a follow-up ultrasound. And that's depending on the modality that we use.
Wow, so they can go home pretty much the same day as a procedure. Now, are these procedures done in a series? Does it just depend on the patient, or maybe it's just one time they go in or a couple of times?
Yeah, I mean, it's most of them are just depending on the severity. Some of them are just, we'll do a couple and they feel great and then just back to normal and then we're done. If they're getting a little more complex on that C criteria or they have ulcerations, we'll have a series of procedures to do on them. We've had patients come in with wounds on their legs. They've had them for a couple of years, and in 6 months they're all gone. And that's a series of procedures that we've gone through. A lot of these patients like to go to work the next day, or they even go the same day. So they'll come in the morning, we'll schedule them in the afternoon, they'll work a whole day, have the procedure done, some of them go back the next day. So it does really depend on the patient itself and the severity of their disease process.
Absolutely. And I realize that you said, first off, that the pain itself, it goes away pretty much same day afterwards through walking and everything, maintains everything flowing well. Now, does the cosmetic appearance of the legs, you mentioned earlier about how after finding the root of the problem, essentially through varicose and spider veins, those could be cleared. Can you tell me a little bit more about, what patients could expect on how the cosmetic appearance could clear up afterwards?
Sure. So the worst case scenario is the stasis changes, those dark discolorations that you have around your calf and the anterior part of your shin. Those typically won't go away as an entirety. So I think a lot of that I explain to my patients, it's part of an iron deposition. It's kind of like a tattoo in a way, but it just fades once you get rid of the pressure building up. That's the best thing you can expect. Itching like venous eczema, kind of flaking of the skin, all the stuff will improve. The cosmetic side, you can get a very good improvement, but it may take a series of treatments. We've had a few patients that have come in that we've done recently that they've come back within a 2 or 3 week follow-up and they're completely resolved. And so sometimes, depending on the spider reticular veins, we may have to do a subsequent treatment after 6 weeks. And then sometimes, depending on the patient and their outcomes, that we won't. So it's very tailored to the patient.
Absolutely. Everything from the beginning to the cosmetics, the root of the problem, tailored to each patient. Now, does every patient that have vein disease need a procedure necessarily, or are there lifestyle modifications, depending on where it's caught?
No, that's a great question, because pretty much I tell my patients all the time, at least 95% of the time, if you can hit the conservative therapy really hard and really aggressively, I won't need to do any work, which makes my life easier actually. So the exercise, the daily activities, the leg elevation, the compression therapy, the weight loss, all those kind of small things add up to a big deal for the legs. And the recent thing that I've been adding is a kind of a low inflammatory diet, staying away from the sugars, staying away from some of those seed oil and processed oils. They cause a lot of inflammation. And I've had a lot of patients recently do that, and they've come back with their legs feeling much better.
Wow.
So conservative therapy, I think if they can really push it, it does work really well.
That's really good to know. And I guess taking it a step even further back, when should someone see a cardiologist if they think they might have vein disease, or they might not even know they have vein disease? That's
a good question. Not all cardiologists fix or intervene on peripheral artery disease or venous disease. So you have to find a specialized person. There is probably bound to be some person in Louisiana or Lafayette that has one person or two people that do that. Typically, when you start having a lot of restless leg, a lot of cramping, that's important. And when it becomes what we call lifestyle limiting, that is the key word. Lifestyle limitations is unable to do your daily activities. You can't go to the store, can't do your yard work, can't go see your family members. Those are the big events that become lifestyle limiting. Can't go to work. Venous disease is so big in the U.S. You've got to think over 40 million Americans have this, and maybe more now. Yes. And it's billions of dollars in lost revenue because of their legs and it's venous disease that are actually hindering them from going to work. And so those are the basic things. And then swelling in your legs is key. Discoloration, venous eczema, venous changes, discoloration, wounds. Those are the times that really need to step and get some treatment or some evaluation done.
Yeah, and absolutely. And as we heard earlier, the diagnosis of vein disease is pretty simple as it is, ultrasounds, pictures. So if a patient's just thinking that they might, because a lot of these symptoms that you're mentioning, it could be chalked into just everyday things, or aging, or, I was standing too long or sitting too long today, I'm feeling some pain.
Sure.
So it's good to just go in and get checked for all of those things. Is there anything else that anyone with vein disease should know?
No, I think that's pretty comprehensive. A lot of this is, CRS, we're here to tailor to the patient's needs. we're not going to unnecessarily do a procedure if we don't have to. The conservative therapy is our mainstay therapy, and the biggest part is just lifestyle improvement. And if we can get that quality of life improvement to our patients, then that's all we really look for here. Some patients do need more treatment than others. Some people don't. And I tell them it's not, unfortunately, a one-stop shop. It sometimes takes a few procedures to get to where we want you to be and where you want to be, to the point is where you can get back to your lifestyle and not be limited.
Absolutely. That's very important. And we want all of the patients to come in before anything, we can get it right there before any kind of procedure or anything major happens of that sort. Well, thank you so much for coming on the show today and explaining all of the different treatments that we provide here at CIS. Thank you for being here.
You're very welcome. Thanks for having me. Appreciate it.
We hope that this has empowered you on your health journey. If you have health concerns, visit cardio.com to learn more or request an appointment. Make sure to follow this podcast as well as CIS on social media for updates. Thanks for listening.